Okay, so I think we'll go ahead and begin. Thank you everyone for joining us today in our community health webinar, Implementing Team-Based Care, which will be presented by Marie Zephyr. For those who would like a little overview of the team-based care system, it is a cost-efficient and collaborative method for addressing healthcare. The Great Plains Good Health and Wellness Team has applied concepts of team-based care to American Indian communities. In this presentation, Marie will cover how principles of team-based care models can be applied to different environments. She will also provide examples and steps to implementing team-based care, as well as providing concrete examples of efficient team-based care programs and providing ideas on how to apply those concepts to your organization. And before we start, just keep in mind to keep your microphone muted, just so that there's no interruptions within the presentation. And also, we will be sending out a survey for you to fill out, so I'll go ahead and send the link within the chat, and then you can go ahead and click on the link and fill out the survey. Right now, we'll go ahead and turn it over to Marie Zephyr, and you can go ahead and share your screen.
Thank you, Eugene, and hello, everybody. I hope you're all having a wonderful Wednesday afternoon. We'll go ahead and start the slideshow here. Okay. So this community health webinar series is a product of the Great Plains Tribal Chairman's Health Board Good Health and Wellness Program. And it is titled Team-Based Care in Indian Country. So today we'll review the problem of our healthcare crisis in Indian Country, discuss the potential solution found in team-based care models, the various benefits of team-based care. I'll also provide examples of team-based care and steps to implementing that model within your organization. Okay, so American Indian and Alaska Native adults have limited access to care through the current health service models that are provided throughout our communities. It's important that we address healthcare for American Indians creatively, especially since Indian health service has been historically underfunded. American Indians and Alaska Natives have higher rates of disease, higher rates of injury, and premature death as compared to other racial and ethnic groups in the United States. The rates of death due to stroke and heart disease, which are both preventable causes of death, are the highest in American Indian and Alaska Native population. The facts prove that we're in dire need of a chance to improve our healthcare delivery, and I'm here today to discuss how a team-based care approach can provide a role for everybody in becoming accountable and achieving higher standards for health in Indian Country. So a potential solution to these problems is team-based care. It's essential to define the team-based care in order to fully understand how our quality of care can be improved. So according to the Institute of Healthcare Improvement, it's optimized team-based primary care that improves the quality, safety, and reliability of healthcare, reduce waste, and better addresses the needs of chronically ill patients. The American Medical Association defines it as team-based care is the strategic redistribution of work among members of a practice team. In the model, all members of the physician-led team play an integral role in providing patient care. With so many chronically ill patients in American Indian and Alaska Native populations, team-based care is crucial to saving lives. Okay, so how team-based care can be the difference in your community? There's a lack of coordination amongst professionals in clinical settings, and a lot of it reduces productivity in the work environment. However, clinicians who've implemented team-based care models discovered that Doctors are able to focus on medicine instead of running the practice, which streamlines care and reduces medical errors and waste. It's also been found that doctors order only the tests that patients and employees need, reducing duplication and overall costs. Caregivers can pull up employees' entire medical history, not employee, but patient, which includes the lab results. And the tests aren't repeated unless they need to be, which also reduces duplication and overall cost. And patients also get their timely preventative care and vaccination, as well as health screenings, which helps avoid and minimize costly chronic conditions and treatment, since you could detect them early. So there's a lot of principles of team-based care that are found in many models, and these lying foundations start with the shared goals. Everybody that's involved in the team, which a lot of times can include the family members, the actual clinicians and physicians, as well as the nurses themselves, as well as the administration, which can include the receptionists and the people who are doing the insurance claims, as well as legal representatives of the patient. As long as everybody knows the same and has the same goal for the patient. Another principle of team-based care is the clear roles, clear expectations regarding everybody's responsibilities, which will hold them accountable, are discussed so people understand beforehand what they contribute to this patient's care. Another aspect of principle of team-based care is mutual trust. The transparency provided in team-based care models results in strong reciprocity and greater opportunities to share success, which results in a trusting relationship amongst patients and providers alike. Effective communication. The team refines its communication skills through consistency and constant contact. And lastly, measurable processes and outcomes. The team shares reliable and timely feedback on successes and failures so that people can track performance and improve accordingly. There's many benefits of team-based care. People who receive holistic care receive better quality care. The costs are decreased as streamlining lowers waste and admin costs. Time saved through better communication. Employee task delegation causes less burnout amongst employees. And employees are also empowered in the decision-making process, which helps them in turn become a part of really taking ownership in providing patient care. Relationships are improved, productivity is increased, and there's just a stronger team balance that's achieved through the action, people, and thought-oriented members. So rethinking primary care. The current model of care goes through many hurdles of communication. As you could see in this left model, this is what we see in a lot of our clinician settings, or even in our tribal health settings. There's just different layers of communication that can sometimes be confusing for the patient or the person receiving care. However, the University of California San Francisco model is here on the right-hand side. And what they do is provide a transparent communication channel where everybody's involved in the patient's care from the time of intake. This transparency includes everyone involved in the patient's care process, from the behavioral health therapist to the insurance consultant and the legal agent. The improving patient care model through the Indian Health Services is supported through the Indian Health Services, tribal and urban Indian health programs, and reducing health disparities. It was developed to achieve success in improving patients' access to care and implementing clinical quality enhancements and ensuring patient satisfaction. This patient-centered medical model home looks different amongst different tribal and reservations. A lot of people were kind of adapted it differently. But it involves an integrated clinical information system that communicates with all the various care providers for IHS patients. It also encourages the use of culture and spiritual aspects of healing, which could be implemented at the family's request. So the IHS care model was developed to include the following key elements: anytime access to the care team, so providers will be available on call, well and fit care through preventative and chronic care. It's intended to increase the high quality, reliable care and coordinate team-based care. Okay, so sometimes we know that we have to adjust those models of team-based care for tribal communities because we're all a little different and so unique to one another. From all of the research combined that I just presented, I feel that it seems most viable to gain the trust and establish a connection with American Indian and Alaska Native communities by being considerate of all the people who have an impact in their care. A lot of times in our communities, there's various layers of care providers, whether it's a federally funded Indian Health Service program, a state health program, or perhaps even tribal health programs that supplement those different funding agencies. And in some cases, nonprofit agencies. Um, it's always important to establish all of the services that could be provided to a patient and find out beforehand what could increase the quality of their care. A lot of times this is established by knowing what's accessible, being open and communicating and information sharing with the different organizations. An example of how this is successfully done is through the South Dakota Urban Indian Health Program. Their prime example actually because they do a great team-based care model. They're located in Sioux Falls and Pierre, and they exemplify how to combine both medical home models in a clinician setting. So their integrated system of care is a full primary care clinic, and within that same clinic, they have a behavioral health clinic embedded. This behavioral health component includes both mental health and substance abuse counseling. So when a patient comes in, all nursing staff, the reception staff, and then eventually the physicians do GIPRA on everybody. If they score high on the pre-screening, they'll go on to another screening for a QPR, which is, and also a domestic violence screening. If the person's really distressed, they can actually see the provider there within their appointment, or if they have a high adverse childhood experience score, a counselor will come into their room and actually assess them right there on the spot. So they kind of embed both the behavioral health and clinical services. They do a really good team-based care model by everybody meets in the morning time for a morning hurdle, and they start with mentioning the mission statement. So everybody cites the mission statement together, and then they go over what patients will be screened that day. So they'll have the entire clientele for the day that has all the appointments, and they'll go over it as a team. And this team includes everybody from the physician to the nurses to the reception staff. And sometimes they'll even have lay providers such as different janitors and stuff in that morning meeting, just so everybody knows who's coming in for what. They obviously follow HIPAA instructions and make sure to know what the patients really need before they come in. This gives them it reduces the duplication of services, and everybody knows what to expect per patient as they come in. Another example of successful team-based care is the Yankton Sioux tribe. They're a good example of how a reservation and tribal health, or a tribal health program, communicates with the Indian Health Service to provide the best care that they can. So Indian Health Service is sometimes limited in what they can provide, and what they can't provide, the tribal health go ahead and supplement. And they do that by coordinating weekly team meetings where they could discuss what are needed for the patients and what they're going to need as far as durable goods, or if they're going to need dietary supplements or help with their eyeglasses. They always identify those needs and discuss them in advance. And anytime the patient isn't able to meet those needs in the IHS setting, then they're then referred to the tribal health program, and they'll be able to receive better care that isn't covered by IHS. For steps to setting up team-based care, it's recommended to first identify the stakeholders who are involved in the team-based care model, and then identify the model of care that you want to implement. Step 3 would be to identify how to strengthen your current system. Maybe you could increase referrals, find a community clinical linkage or a communication system that will strengthen your capacity to meet a patient's needs. Step 4 is to delegate the persons responsible, set up an accountability model through SMART objectives that will dictate when the meetings are going to be, how the model is going to be implemented, and who's going to be responsible. Step 5 is to identify the communication strategies, whether you're going to have a monthly meeting, whether it's going to be a phone call or an in-person meeting, whether it's going to be via email, but just clearly identify those communication strategies. And finally, step 6 would be to implement and practice. Okay, thank you everybody for listening to the team-based care presentation. Are there any questions?
Thank you, Marie. So we'll leave this open to any questions that anyone has at this time. Also, please keep in mind to click on the survey, the feedback form, and fill out the survey. So Marie?
Yeah.
In what ways can Great Plains provide TA for team-based care in a tribal community or organization?
Well, I apologize for being a little nervous today, but one way that we can provide team-based care is to help people adapt the models or set up meetings with those programs that already successfully implement those models. So if anybody's interested in that, we could go ahead and assess your need and help you to address it how you would like, based on what we know from this research.
Thank you, Marie. So if we don't have any questions, I'd like to thank everyone for joining us. And our next community health webinar will be in June, and that will be on the 21st. And it'll be health literacy, which I'll be presenting on. So please write that down in your calendar. Also, we'll be sending out an invitation for that webinar as well. And once again, I want to thank everyone, and this webinar is recorded. So we'll go ahead and send this out to people who have joined, who have provided their email. So if you feel like anyone could benefit from this webinar, please go ahead and forward that out to them. But once again, thanks everyone for joining us, and have a great day.
Thank you.
Thank you.